The single most frequent inquiry I receive across my social media platforms is, how can I increase my size? How can I achieve greater length or more girth? Today, I will directly address these questions and provide you with the evidence base concerning treatments for penile lengthening. I am Dr. Emily Hatwell, MD, a board-certified urologist and pelvic surgeon. For those unfamiliar, a urologist is a physician who manages the genitourinary tract, employing both medical and surgical approaches. If you find the information presented here valuable, please ensure you subscribe so you don't miss our new videos. What exactly is the normal penile length? Did you know that a study involving 50,000 heterosexual men revealed a significant finding? A striking 55% of these men expressed dissatisfaction with the aesthetic appearance of their penis. Conversely, when researchers questioned the partners of these men, 85% of the women reported being satisfied with the look of their partner's genitalia. Ultimately, however, your personal feelings about your own appearance are what truly matter. This issue is complicated by the fact that pornography has significantly distorted the perception of what constitutes a normal male anatomy. I have previously produced a video detailing the average penile dimensions. Based on a comprehensive review of the data, the approximate average penile length is 5.2 inches or 13.2 centimeters. A penile length is considered within the normal range if it falls within 2.5 standard deviations of this average, whether longer or shorter. So, what is medically defined as an abnormally short length? Any measurement less than 2.9 inches or 7.5 centimeters is classified as a condition known as micropenis. Micropenis is exceptionally rare, affecting less than 1% of the population, specifically about 0.14%. This condition can stem from various causes, including congenital anomalies, hormonal imbalances, prior surgical interventions, or cancer. However, our discussion today will focus on individuals who possess a medically normal penile length. Small penis anxiety, what it is and what it does. While it is true that the vast majority of men who express concern about their pineal size fall within the normal range, the core problem is that a substantial number of men experience significant psychological distress stemming from the belief that their penis is not as long as they would prefer. This is recognized as a form of body dysmorphic disorder, which has been formally termed small penis anxiety, SPA. This diagnosis does not imply that the individual has a small penis, but rather that they suffer from anxiety related to their perception that their size is inadequate. SPA is characterized by an intense preoccupation or obsession with the size of the penis, where the individual spends more than 1 hour per day dwelling on this thought. For some men, this level of preoccupation can become so overwhelming that it interferes with their activities of daily living. In severe cases, this intense obsession can lead to hospitalization or even suicidal ideation. This is a serious matter with potentially severe complications for affected individuals, and it is a critical component of men's health that must be discussed. Another major challenge associated with this concern is the overwhelming amount of unreliable information available online. If you search for how to make my penis longer, you will be flooded with countless websites and sources that may not be reputable. Tragically, many individuals seek out non-licensed practitioners or travel abroad for procedures that can result in catastrophic consequences. I urge you, please do not pursue these options. Instead, seek consultation with a qualified urologist or a mental health professional specializing in these concerns. Before I delve into the specific treatments, I must provide a crucial context. The Sexual Medicine Society of North America advises that procedures intended for penile lengthening or girth enhancement are not recommended and are classified as experimental unless they are performed in the context of a true micropenis diagnosis. The information I am about to share is documented in the urological literature and is supported by some clinical data. Nevertheless, before undertaking any of these interventions, you must establish care with a urologist who is knowledgeable about these topics. As a personal disclosure, I do not offer or discuss penile lengthening treatments in my own practice. However, given the immense importance of this subject, I have conducted the necessary research for you. Surgical and non-surgical treatments for penile lengthening. Treatment options for individuals experiencing distress or anxiety related to the perceived size of their penis fall into two main categories: non-surgical treatments and surgical options, both of which are reported in medical literature. Non-surgical treatments. We begin with psychological counseling. Validated questionnaires, assessments, and therapeutic measures are available to help patients gain a realistic understanding of normal penile size and manage the associated anxious feelings. It is noteworthy that among individuals who undergo psychological counseling alone, the vast majority no longer feel the need to pursue any further non-surgical or surgical enhancement treatments. This is a powerful finding, and I strongly recommend that anyone suffering from this anxiety seek psychological care as a first step. There are three other non-surgical modalities. 1. Penile extenders, traction devices. 2. Vacuum erection devices. 3. Penile injectable treatments. Of these three, penile extenders are the only option with data suggesting a measurable increase in penile length. These devices consist of a ring for the base, two metal rods, and a silicone ring to secure the glands. They work by mechanically and slowly applying traction to the penile tissue over an extended period, many months, requiring significant daily time commitment. When reviewing the data, men who consistently and diligently use these penile traction devices did achieve some gain in length. Measurements were taken using the flaccid stretch length, which urologists use as a reliable estimate of the erect size. After months of daily use, the average gain was approximately 2 centimeters. While a gain was achieved, it was quite modest. Achieving this effect requires extreme compliance using the device for several hours every day. Potential complications include numbness, bruising, or simply a lack of efficacy, meaning you could dedicate significant time without seeing any benefit. This is the only non-surgical method consistently shown in the literature to offer positive results with a low risk of side effects. In contrast, vacuum erection devices have been shown to cause no increase in penile length whatsoever. Finally, penile injections. Numerous injectable substances have been attempted over the years, and many have resulted in devastating complications. I strongly advise against any form of penile injection. Currently, the data is insufficient to recommend any type of injection into the penis, and as mentioned, the complications can be devastating, sometimes appearing up to 40 years after the procedure. Please do not inject anything into your penis. A variety of surgical procedures have been discussed and documented in the literature. One of the most frequently mentioned is the suspensory ligament incision. The penis is anchored to the pubic bone, the bone directly in front of the penis, by a ligament. Releasing this ligament can provide a small amount of additional length. However, this procedure is not without its own set of complications. Other techniques involve the use of various flaps, grafts, and even rib cartilage to enhance length. Overall, these methods are associated with poor outcomes and low patient satisfaction. The studies that have reported results for these specific surgeries have often lacked rigorous reporting standards. Therefore, At this time, we cannot recommend any surgery to increase penile length that does not carry a multitude of risks and complications. The only circumstance under which you should consider a penile lengthening surgery is within the context of a formal clinical trial. A clinical trial is conducted at an institution with an Institutional Review Board, IRB. The IRB's role is to ensure that any study performed on human patients is safe and ethical. They also mandate regular data monitoring and a system for reporting adverse events that occur during the trial. This ensures that any negative outcomes resulting from the surgery are accurately documented and subsequently published in the medical literature. This process provides us, as urologists, with clear, complete, and true data. For example, we can then determine if a procedure performed on 100 patients resulted in only 10 minor complications versus 20 severe complications, allowing us to scientifically assess safety and efficacy before recommending it for general practice. The bottom line is that there is very little you can do to fundamentally change the length you were born with. You may achieve a minor increase in length with penile traction therapy, which is supported by literature. However, many other methods are either still under investigation or are not recommended for routine clinical care. I believe the most important first step is to seek treatment from a psychologist to address the underlying anxiety before pursuing any irreversible procedure that could leave you with a disfigured, non-functional result that is worse than your starting point. Thank you so much for watching, and always remember to take care of yourself because you are worth it.